Hi, today we are going to study on approach to headache. As we know, a headache is of two types, unilateral and bilateral. So these are some of the buzzwords of different types of headache, so which is especially helpful for us in NEET PG. So the headache which is pulsatile and which lasts for 4 to 72 hours, and it is associated with nausea and vomiting, and it is having an aura. A person can feel some aura, that is nothing but migraine. So the first line that can be given for migraine is NSAIDs. Then drug of choice is 5-HT1B and 1D agonist, that is nothing but triptans. So normally we know that from the trigeminal neurons that CGRP is released, which will cause neuronal inflammation and vasodilation. That is what causing the migraine. So we have to inhibit the CGRP release, we have to inhibit. So there is some breaks, that is nothing but 5-HT1B and 1D, which we will agonist are there, which we have to stimulate, that will release to the that will release to CG if that will inhibit the CGRP. Thereby triptans are helpful in 5-HT1B, that is acting like a brake. Next is prophylaxis is propranolol, and another one is nothing 5-HT1F, that is nothing but lasmiditan. Here the triptans are causing what? Vasoconstriction. That's why it is contraindicated in angina patients, because this 5-HT1B or 1D is also present in blood vessel. So when blood vessels are, this is given, triptans are given, it will cause vasoconstriction, and therefore it is contraindicated in angina patient. So like that, 5-HT1F is nothing but lasmiditan. Then there are CGRP antagonists, that is nothing but gepants and monoclonal antibodies, the ramegepants, erinumab and galanezumab. Okay, if it is no and ni is there, that is it is acting on neurons. Okay, next one is unilateral, that is repetitive periorbital, having lacrimation and honor syndrome, and it is more common in male, that is in female than female. That is something different, right? Normally female is having more headache, but here male is having more headache, and it lasts for 15 minutes to 3 hours. That is nothing but cluster headache. The cluster headache drug of choice is 100% oxygen and triptans we can give. The prophylaxis is verapamil. Okay, next is the headache, which is lasts for 2 to 30 minutes, and it is responding to indomethacin, that is nothing but paroxysmal hemicrania. Another unilateral headache, which is lasting for 5 to 200 seconds, and it is associated with burning and stabbing pain, it is nothing but SUNCT. See here, there is some mnemonic which is given to SUNCT. It is short lasting and unilateral neuralgiform headache, and the headache which is attacks with conjunctival injection and tearing, this is nothing but SUNCT. Another headache which our Salman Khan has, he has publicly announced that he is having this, that is nothing but trigeminal neuralgia. It also lasts for 5 to 200 seconds, and it is triggered by chewing and touch. It is around V2 and V3. This is nothing but trigeminal neuralgia. The drug of choice is carbamazepine. If it is not controlled, then we will give by gamma knife for refractory. Last one is bilateral, that means band like headache through and the both sides the headache is there, that is nothing but bilateral headache. If it is band like and it lasts for 4 to 6 hours, this is nothing but tension headache or stress headache. Okay, this normally most of the people have. Then what we will give for tension or a stress headache, we will give NSAIDs, and prophylaxis is TCA amitriptyline. Okay, next one is a headache which is bilateral headache, dull aching, papilledema. It is with papilledema, 6 cranial nerve palsy, and the risk factors is tetracycline, obesity, then vitamin A, donazole, like toad is a risk factor. This is nothing but idiopathic intracranial hypertension. Here what is nothing but optic nerve will get tortuous because CSF will get filled here and CSF will lead to intracranial pressure. So what we have to remove the CSF. So we can do some invasive procedures like lumbar puncture or optic fenestrative procedure, or we can do weight loss or acetazolamide. That is what for approach to headache. So it is easy unilateral, bilateral, migraine, cluster headache, which is more common in male and female, and paroxysmal, which respond to indomethacin, SUNCT, which is having a very different mnemonic, and Salman Khan headache, nothing but trigeminal neuralgia, then bilateral, which is tension headache, then last one is idiopathic intracranial hypertension. So look forward to it. It's very important for NEET PG. All the best. Thank you.